Hi everyone. This week's quiz 7 for top 200 drugs. This topic is blood and immune system. All right, the first drug is heparin. It does not have any brand name since it's such an old drug, and it is actually naturally occurring um, anticoagulant. So heparin is the only name you need to remember for this. It is used very the most commonly used injectable anticoagulant in the hospital setting, and it is used for the treatment of and prevention of venous thromboembolism. So when I say venous thromboembolism, there's a blood clots formation in deep vein in legs, which is called DVT or deep vein thrombosis, or clots can break up and travel to lungs and cause pulmonary embolism. So VT or venous thromboembolism kind of talks about DVT and PE, pulmonary embolism. All right, so enoxaparin, it is type of heparin, but it is classified as low molecular weight heparin, which means it is a short chain version of heparin. So from this change, low molecular weight heparins are more predictable compared to heparin, which is naturally occurring one. So it's synthesized to have shorter chain, and its action has much smaller risk and less side effects compared to heparin. Also, same thing, used for prevention and treatment of venous thromboembolism, and its brand name is Lovenox. Now, warfarin is most commonly used oral anticoagulant. So remember, the heparin and enoxaparin, they are both injectable. So heparin can be given intravenously, or it can also given intramuscularly, and enoxaparin is usually given intramuscularly, whereas warfarin is oral, so it's taken by mouth, not same anticoagulant, and it is classified as vitamin K antagonist, which means that it works by deactivating vitamin K, which is really important thing that we need in the process of coagulation. So our body naturally, needs, coagulation system. So when we bleed, our blood should stop by clotting, right? So there are many clotting factors that are involved in this process, and many of those factors they need vitamin K to work in the process, and many so the because it works by deactivating vitamin K, it has a lot of interactions with other drugs and also with food that contains vitamin K. So vitamin K is very enriched in green leafy vegetables like spinach, broccoli, and salads and stuff like that. So anything green. So that's why it is really not as easy to work with this drug because of interaction it comes with it. So therefore, and I forgot to mention that the brand name for warfarin is Coumadin, and also, of course, as an anticoagulant, it works to treat and prevent venous thromboembolism. So because of these interactions with warfarin, even though it works really well and it's really cheap since it's really old drug, they came out with a newer type of oral anticoagulant, and then one of it is called rivaroxaban with brand name Xarelto. It is factor 10A inhibitor, of course, anticoagulant. So what that means is, as I mentioned, there are many clotting factors that are involved in the process of coagulation. Warfarin works specifically on four clotting factors out of many clotting factors out there, whereas rivaroxaban only works on one of the clotting factors, in this case, clotting factor 10A. Since it is working directly on one factor, it is much cleaner drug, much less drug interaction compared to warfarin because it's just working on the factor 10A instead of um, inhibiting vitamin K. So rivaroxaban has much less drug interactions, and there's no really food interaction with food with vitamin K. So These are considered novel or oral anticoagulant or direct oral anticoagulant. Clopidogrel, or brand name Plavix, it is an antiplatelet agent. So remember the ones we talk about, all the heparin, enoxaparin, warfarin, and also rivaroxaban, the first four drugs, those are anticoagulants. So we're trying to prevent blood from clotting, whereas clopidogrel is working to prevent platelets from forming. So it is working to prevent and treat acute coronary syndrome, which means that we are trying to prevent heart attack or stroke and anything that can happen because of the all those platelet formation. So methotrexate, it has brand name Rheumotrex. It is considered one of the disease-modifying anti-rheumatic drug, or we often call it DMARD. So DMARD means these drugs in this DMARD class, they slow down the disease progression of rheumatoid arthritis, whereas we often use NSAIDs. Remember talking about non-steroid inflammatory drugs. So NSAIDs are not really slowing down the disease progression, but they work for treating the symptoms of rheumatoid arthritis. So any drugs that actually slow down the process of disease, they are classified as DMARD, or disease-modifying anti-rheumatic drug. So methotrexate is really common drug that works in treating cancers and many inflammatory conditions, of course, including rheumatoid arthritis. All right, hydroxychloroquine, or brand name Plaquenil, it was first invented as anti-malarial. However, it is more commonly used to treat rheumatoid arthritis, also lupus. Of course, it is anti-malarial, so it is working in malaria prophylaxis and treatment, but not really mostly used for rheumatoid arthritis. And it is another drug that is within the category of DMARD, or disease-modifying anti-rheumatic drug, just like methotrexate. All right, so epoetin alpha, or brand name Procrete, is erythropoiesis stimulating agent used for treating anemia associated with chronic kidney disease or chemotherapy. So remember, we learned another drug in the same class, dalbipoetin alpha, or brand name Aranesp. So it is a hint that this may be a bonus question for the quiz. So I mentioned back then that erypoiesis is a process that produces red blood cells. So epoetin alpha or dalbipoetin alpha in this class, uh, they are used to stimulate the process of making red blood cells. That's why we are using this to treat anemia. And epoetin alpha is the first one that was introduced. So it was before darbepoetin alpha. All right, so acyclovir, the brand name is Jovirex. It is antiviral, used for herpes zoster, herpes simplex virus, or genital herpes. Remember that we learned valacyclovir, I think it was from the last week. So actually valacyclovir, or brand name Valtrex, that is a prodrug of acyclovir. So acyclovir is an older drug and valacyclovir was developed afterwards. So compared to acyclovir, valacyclovir provides longer duration of action. So you have to take it just 4 times daily. So acyclovir, actually, you have to take it up to 5 times a day, whereas acyclovir, you can only take 2 to 3 times daily. So acyclovir is not as favored anymore. However, it's much cheaper option compared to valacyclovir. All right, Cefdinir, or brand name Omnicef. It is 3rd generation cephalosporin antibiotic. susceptible for infections, including respiratory tract infection. So it is available in capsules and suspension, so something that you take by mouth. So pretty much it is an oral version of ceftriaxone that we went over last week. All right, so vancomycin, or brand name vancomycin, it is in the class of glycopeptide antibiotic. It is considered the gold standard for MRSA infection. So MRSA stands for methicillin-resistant Staph aureus, and so it is very resistant type of infection. So when we are suspecting MRSA infection, that we usually use vancomycin given intravenously. When it's given by mouth or orally, it does not get absorbed to system, so it is used to treat for C. diff diarrhea. So remember, infections with MRSA, it should be given intravenously, and to treat C. diff diarrhea, it should be given by mouth. All right, so penicillin VK, or brand name PenVK, it is penicillin antibiotic. So penicillin is one of the major class of antibiotic that works by killing bacteria by inhibiting cell wall synthesis of bacteria, used for many different types of infections. So penicillin is the one of the oldest antibiotic that has been introduced to us. So amoxicillin, or brand name Moxitag, it is another type of penicillin antibiotic. It is basically semi-synthetic penicillin. So they changes around to develop this amoxicillin, and it is much better absorbed compared to other oral penicillins, and also has wider antibiotic spectrum, meaning that it covers wider spectrum of bacteria. So this really is most favored oral penicillin compared to other ones like penicillin or ampicillin. All right, so amoxicillin in combination with clavulanate. The brand name is Augmentin. Of course, it has amoxicillin, so it's penicillin antibiotic. So clavulanate, it is a beta lactamase inhibitor. And do you remember that we went over Unasyn, or the combination of ampicillin and sulbactam? It was from quiz 1. So remember, sulbactam was an inhibitor of bacterial beta lactamase. Similar to that, clavulanate in this case is a beta lactamase inhibitor. So by combining this clavulanate to amoxicillin, this combination Augmentin has better coverage, and it is efficacious against the bacteria that is resistant just to amoxicillin. So it kind of try to increase the efficacy of amoxicillin by combining clavulanate. Piperacillin with tazobactam, brand name Josine, just same as the one we just talked about, Augmentin, or Unasyn. Josine is same thing, combination of piperacillin, which is penicillin antibiotic, with tazobactam, which is beta lactamase inhibitor, to increase the efficacy of piperacillin. So Josine and Unasyn are very similar, but there is slight difference in what they cover in terms of bacterial coverage. One thing I forgot to mention, that Augmentin, or amoxicillin with clavulanate, is an oral form, so it is something we take by mouth, whereas Unasyn and Josine, they're given intravenously. All right, so sulfamethoxazole, or in combination with trimethoprim, its brand name is Bactrim. Its class is sulfonamide antibiotic agent, and used for infection. Of course, it is an antibiotic. It is very commonly used for skin and tissue infections, and you probably see this a lot if you already work in the pharmacy. Very common antibiotic that's given for many different types of infection. All right, so next four drugs are all corticosteroids. So first one is prednisone. Has brand names Sterapred. It is corticosteroid. So it is basically when we are lacking naturally occurring corticosteroid in our body, or sometimes we need more to suppress inflammation or allergic condition. So prednisone is the one of the most commonly used corticosteroid that we can take by mouth. Methylprednisolone is another corticosteroid that we use very often. It has brand name Solu-Medrol. I don't know if you guys have seen Medrol dose pack, which is a pack of 21 tablets of methylprednisolone that you take and you taper down the dose daily. So a lot of time when we give corticosteroids, we have to taper the dose, which means we give higher dose and we have to slowly um, decrease the amount of corticosteroids daily as we throughout the course. So it is also used for inflammatory or allergic reaction. So very commonly used medication. Now, when prednisolone is available for ophthalmic use, which means it is formulated for as an eye drop, it has the brand name Pred Forte. So it is ophthalmic corticosteroids. So whenever there is any eye condition, so there's inflammation of the eye, or if there's any allergic reaction going on in your eyes, that's when we can use. So remember that prednisolone in eye formulation or eye drop, it has brand name of Pred Forte. Whereas when it is formulated to be taken by mouth, it has brand name Millipred. So same thing, systemic corticosteroid and used for adrenal insufficiency. So adrenal insufficiency is when we don't have enough cortisol or corticosteroid produced in us, or whenever there's any allergic condition or asthma. So whenever we need extra corticosteroid, we can give prednisolone. So there are many different types and formulation, but they're all corticosteroids. So that's all I have for today and this week. So I hope you guys um, find it helpful, and good luck with your quiz 7. Have a great weekend, guys. Bye.